lean forward, lean on your lap with your elbows or your hands. Okay, action. All right, so this is a basic application of RockTape to help mitigate low back pain. The elongated position is leaning forward. I'm putting 2 stabilization strips from the bony prominence on the pelvis here up to just above where the stiffness is in pain. So I'm measuring it out. I'm going to do 2 of them, so I will just make 2 of them, cut around my corners. Rounding the corners helps reduce the chance of the sharp edges catching on clothes and coming off, because when the tape comes off it doesn't work. So once I've done that, I pre-tear my anchor a couple inches from one end. Okay, I keep the backing on as I place the tape where I want it to be. I take the backing off and set the bottom anchor. I like to set the bottom anchors first so that I work my way up. If I happen to go too long, then it's not an issue. Pop off the end. I'm going to put this on with no stretch so that when the tissues shorten, the tape recoils, gently lifts, reduces that stiffness and tone, down regulates it. Rub it in to make sure all the edges are down, and this also helps to activate the adhesive. And then where the major stiffness or pain is, I'm going to put 2 decompression strips. And that provides direct fascial lift. A direct fascial lift will help mitigate the pain or stiffness in a more isolated, focused manner. So pretty much the same steps as I did on the stabilization strips to round my corners. The big difference on the this decompression strip is that I'm going to tear down the middle, 1 tear, fold it, hold it, grab it so that I can put the most amount of stretch I'm going to put on here is 50%, but I'm only going to put about 25%. Set my anchor boundaries so that only the middle section has stretch on it, and then the anchors never have stretch on them. I'm just gently wiping those down. You never want to put stretch on the anchor because that will increase the chance of skin irritation on a piece of tape that has a lot of stretch on it. So again, 0 stretch, maybe about 10 to 15% of your hands, plus the 10 to 15% that's already on the tape, adds up to about 15% stretch in total on that middle section. Again, no stretch on the anchors. And so when she sits back up, you'll see little convolutions, and I'm done.